especially in the United States, for people who are suffering from deep depressions. Their life is in danger. And it's not something that's used as a matter of course for depression at all. We need to talk about now different types of brain surgery. And we'll need to be introduced then to Dr. Menez back in 1935. Dr. Menez was a physician and a researcher, and he had already had international acclaim because he had developed a system to use radioactive tracers in the brain. But he was looking for something that would help him win the Nobel Prize. He was in Great Britain when some researchers presented at a conference some research they had done with very violent chimpanzees. And what they had done is they had done surgery on their brains and severed the frontal lobe from the rest of the brain, and it had calmed these chimps down completely. Now, I wanted you to look at this date, 1935. This was before any of the antipsychotic drugs came in. This was a time period when we had institutions that were very overcrowded with violent patients, with people who had severe hallucinations. There was no way to control it. The whole mental health community was just overwhelmed with this problem. And Menez began to think, okay, if this will calm down chimpanzees, I wonder if it will calm down human beings so we can communicate with them better, that they will be more manageable. And he began to perform this surgery. In order to do this, he trepanned the skull. In other words, he cut a hole in the skull of the patient, and he used what he called a leucotome, which is kind of like a whisk that you have in your kitchen to stir things, but it's pushed together and kind of hooks up on the end. And what he does is what he did was he trepanned the skull, and then he stuck this leucotome in, and he would move it back and forth, disconnect the frontal lobe from the rest of the brain, close up the hole, and let the patient recover for a few days in the hospital. And people who had been violent, totally unmanageable. In fact, we used to have an old videotape in our library of this patient who was totally out of control. Then he had this surgery, and now he's sitting calmly in his chair, and he's carrying on a conversation. Didn't seem to affect their intelligence level, but it did bring them under control when they were violent patients. Think of a catatonic patient going into that agitated state and destroying everything around them and hurting other people. This would be an advantage in that particular time period. When it came to the United States, Dr. Freeman in the United States was paying close attention to what was going on. And he said, this would help us a great deal in our institutions. But in the United States, we usually kind of tweak things. Henry Ford already had shown us a lot of different things you can do about mass production. And this is what Dr. Freeman had in mind with his partner, Dr. Watts. They started out trepanning and using the leucotome, but they decided to abbreviate the process. At least Dr. Freeman decided to abbreviate the process. And what he did was, instead of cutting open the skull, which caused the patient to have to really stay in the hospital for a few days, he entered behind the lobe. Remember Phineas Gage when that iron bar went behind his eye and severed the lobe? What he did was he took an ice pick, and I'll read you the exact statement here. Let's see here. Instead of a leucotome, which required surgical trepanning, he used a common tool to break ice, which could be inserted under local anesthesia by tapping it with a hammer, a real hammer. The ice pick would perforate skin, subcutaneous bone, meninges in a single plunge, and then Freeman would swing it to sever the prefrontal lobe. This would take no more than a few minutes, and it was no need to intern the patient in the hospital. The procedure was so ghastly, however, that even seasoned and veterans, neurosurgeons, and psychiatrists could not stand the sight of it and would sometimes faint at the production line of lobotomies. James Watts was very distressed by it. He severed all his relationships with Dr. Freeman. Despite that, in the 1940s, with all the cases of severe psychosis in the hospitals, between 1939 and 1951, more than 18,000 lobotomies took place in the United States. In other countries, they were often, unfortunately, used for other purposes. They were often used to maintain control over the population if you disagreed with someone politically. In Japan, they actually used the prefrontal lobotomies on children who had behavior problems. So it was used all over the world. Fortunately, the antipsychotic drugs began to kick in and become available. And this is the story of prefrontal lobotomies.